All right. Well, good morning, everyone, and welcome to Security Health Plan Academy, our monthly webinar series designed to provide you with valuable information relevant to your health, wellness, and healthcare plan. In today's session, we will provide an overview of high blood pressure and its long-term risks. We'll also discuss how to adjust your lifestyle to control your blood pressure and avoid long-term complications. We are honored to have Marshfield Clinic Health System nephrologist Dr. Rebecca Blonsky with us today. Dr. Blonsky completed her internal medicine residency at Marshfield Clinic Health System and a nephrology fellowship at the Cleveland Clinic Foundation. She and her husband live in the Stevens Point area with their 3 children, and they enjoy outdoor activities, including family walks and bike rides. I would like to now introduce Dr. Blonsky. Dr. Blonsky, feel free to get started.
Awesome. Thank you so much. As you stated, I'm Dr. Blonsky. I am a nephrologist or kidney doctor with the Marshfield Clinic. So today I'm going to be talking about high blood pressure and its effect on your kidneys. So the objectives of this presentation and talk is to understand what high blood pressure is and how we diagnose it, its impacts on the kidneys, and what you can do to manage your blood pressure and protect your kidneys. So to start, what is hypertension? So hypertension is the medical term for high blood pressure. So we usually define high blood pressure of a pressure more than 140 over 90 on at least 2 separate visits to the doctor when you're not acutely ill. So high blood pressures in the ER or at urgent care when you're sick with something else don't count. Your doctor, though, may have some different goals for your blood pressure based on your medical problem and other factors. So hypertension is a high blood pressure inside of all of the blood vessels in your body. So how do we diagnose high blood pressure? How do we check it? So it's monitored with the use of a blood pressure machine. So these can be automated, meaning that you push a button, they run on their own, or manual when the doctor or her assistants check it. So this is an exemplar picture of an automated blood pressure cuff, typically a home cuff. And then this is a picture of somebody checking blood pressure manually, or a manual blood pressure cuff. Can I monitor my blood pressure at home? Absolutely. We actually really would like you to monitor your blood pressure at home. So monitoring blood pressure at home gives us a lot more information on how well controlled your blood pressure is. So blood pressure can change really second to second, minute to minute, and having more data points and more information on how your blood pressure is overall really helps a lot. And it helps us figure out if you have a component of what's called white coat syndrome or white coat hypertension, where when you're in a clinical setting, even if your doctor isn't wearing a white coat, your blood pressure might be high. So how can I be sure that my blood pressure readings are accurate, meaning your home blood pressure readings? To make sure your readings are accurate, there's quite a few steps that you need to take. Now, if you learn these steps, it becomes second nature when you're checking your blood pressure. So first, your cuff needs to fit properly. Your doctor's office can check how your cuff fits. If a cuff is too loose or too tight, your blood pressure readings are not going to be accurate. Your cuff should be on bare skin, not over clothing. So you can check your blood pressure any time of day. There's no right time of day to check it. But if you're on blood pressure medicine, you want to wait at least 30 minutes after you take your blood pressure medicine to check, because we want to know what is your blood pressure on the medicines we prescribe you. Before you check, you want to rest and relax at least 10 to 15 minutes to give yourself time to cool down, calm down. You don't want to check right after you've been exercising, running around, doing errands, because your blood pressure will be on the higher side. When you check, sit in a chair with a supportive back, both feet flat on the floor and your arms supported. So you want to have the cuff about the level of your heart. Don't check within 30 minutes of having caffeine, smoking, or exercising. Again, those are all going to raise your blood pressure. Don't check with a full bladder. We all know how uncomfortable it can be to have a very full bladder. So make sure that you empty your bladder prior to checking. Don't talk or actively listen. Again, these activities that engage us can cause the blood pressure to go up. And then again, make sure that your arm is very well supported with a cuff at the level of your heart. So if you have an arm cup, having it about the level of your heart, or if a wrist cup, keeping that wrist about the level of your heart. Now, if you've been diagnosed with high blood pressure, what can you do to control it? So the first step is always lifestyle modifications. So these can have very significant impacts on your blood pressure. So what are these lifestyle modifications? Dietary changes. So limiting your salt, limiting your caffeine, eating a DASH diet or dietary approach to stop hypertension. So this is really low salt, more whole foods, fruits and vegetable type diet, and limiting your alcohol intake. Stopping smoking helps to lower your blood pressure. If you're overweight or obese, losing weight. You don't have to have a normal body weight to have the improvements of your blood pressure from this. Even losing 5% of your body mass, if you're obese or overweight, can help lower your blood pressure. And then your doctor may recommend these changes, but may also want to start blood pressure medication. So before we go on to blood pressure medication, what effects on your blood pressure do lifestyle modifications have? So weight loss, so losing weight or maintaining a normal weight can lower your blood pressure between 5 to 20 points. Eating that DASH diet or the low salt, more fruits and vegetable diet can lower your blood pressure by 8 to 14 points. A low salt diet or less than 2,600 milligrams a day or 2.6 grams a day lowers blood pressure between about 2 to 8 milligrams or 2 to 8 points. Now, remember, one big thing I remind patients is the standard American diet, which is also known as the SAD diet, has a lot of salt in it, and it's usually about 6 to 9,000 milligrams, so quite a bit more than recommended. Increasing your physical activity. So making sure that you're physically active between around 30 minutes a day can lower your blood pressure 4 to 9 points. Now, when I talk to my patients about being physically active, it's what you like to do. So if you don't like walking around outside, you don't have to walk around outside. If you like biking or dancing or doing an exercise class or gardening, those are all great activities to be physically active. And then reducing your alcohol intake. So drinking no more than two drinks a day will lower your blood pressure between 2.5 to 4 points. So common medications. Some of the most common medicines that we start people on for blood pressure is medicines like lisinopril or amlodipine. Now, your doctor may choose something different, and if you have questions about the medication or choice of medication, please ask. If you're prescribed medicine to control your blood pressure, you may have side effects from it, but it's important to talk to your doctor before you stop taking it. And then other things that impact your blood pressure. So sometimes other medicines can raise blood pressure. So some common medications include stimulants, NSAIDs, so medicines like ibuprofen, Aleve, Motrin, naproxen, etc. These can all raise the blood pressure. Oral contraceptives can, some antidepressants, some calcineurin inhibitors or immunosuppressants, and then chemotherapeutic agents or chemotherapy can sometimes raise the blood pressure. Uncontrolled sleep apnea can also raise the blood pressure quite a bit. So if you have sleep apnea and you are supposed to be wearing a CPAP, it's really important that you do use it. Now, if your CPAP mask is uncomfortable or doesn't fit well, please reach out to your doctor for a refit or other options to help control your sleep apnea. Now, moving on to the kidneys. How are my kidneys affected? Now, the first part to talk about is what do my kidneys do? So the kidneys are the main organ, one of the main organs that are responsible for cleaning your blood. So they're really just a bunch of little specialized blood vessels squished together, and they're made up of very small blood vessels, and anything that affects small blood vessels affects the kidneys. So this is a picture of the kidney. So most people have two kidneys. Some people only are born with one, and that's okay. Now, this outside part is called the renal cortex, and this is where all those glomeruli or working part of the kidneys live, those very specialized blood vessels. So the blood goes in and then spreads out throughout this whole kidney, where all the little tiny blood vessels help to filter the blood and remove toxins and balance all the vitamins and minerals in your blood. And then the filtered or clean blood goes back to your body, and then all the waste goes into the urine, which then goes to your bladder and then out to the toilet. So how are my kidneys affected by high blood pressure? So over time, the kidney will start having damage from the high blood pressure and start to scar. So if you think of the blood vessels in the kidney as these small blood vessels, it's kind of like trying to push water from a fire hydrant through a garden hose. As the kidneys scar, your kidney function will decline and you can start to have chronic kidney disease. Now, high blood pressure affects not just the kidneys, but other organs as well. So your brain, your heart, and then all of your blood vessels can also be affected by long-term uncontrolled high blood pressure. And that can cause heart failure, strokes, or what's called peripheral vascular disease, or poor blood flow to the blood vessels in your body. Now, why is CKD bad? So having chronic kidney disease increases the risk for heart attacks and strokes. You can also have other complications because the kidney not only cleans the blood, but it sends a lot of signals to the rest of the body. And if your kidneys aren't working well, you can have complications like anemia or low blood counts, osteoporosis, like blood thinning, and heart problems. And then if it progresses, you can end up with end-stage kidney disease or kidney failure and need dialysis. So how can we avoid these complications? The best way to avoid it is to prevent it. So prevention includes controlling your blood pressure. If you have diabetes, controlling your diabetes and remaining physically active. Really, overall, the healthier you are, the healthier your kidneys tend to be. So takeaway points. First, proper measurement of your blood pressure is important. Some of you may have DME benefits and you can get a blood pressure machine at home that's covered for home monitoring. If you're prescribed blood pressure medicine, it's really important that you take it as it's prescribed. If you have any side effects or concerns about the blood pressure medicine, please reach out to your doctor. Following a low salt diet, exercising regularly, if you're overweight or obese, losing weight or continuing to maintain a normal weight will also help control your blood pressure. And then controlling your blood pressure helps decrease long-term risks of getting chronic kidney disease, as well as decreasing risk for heart and vascular disease like heart attacks and strokes. Questions?
Thank you so much, Dr. Blonsky. We received quite a few questions in advance of today's webinar, so we'll get through as many as we can today. And if
Perfect.
folks have any questions on the call today, feel free to type a question in the chat feature on your screen, or you can ask to be unmuted and you can ask your question live, whatever you're most comfortable with. But the first question, Dr. Blonsky, was how do I lower my diastolic blood pressure or my lower number?
That's a good question. So the blood pressure, you have a top number systolic and lower number, which is diastolic. So the bottom number is how well do your blood vessels relax. So it's really the same treatment as treating your top number. So making sure that you are taking your blood pressure medicines, making sure that you're remaining physically active will help improve what's called compliance or how well the blood vessels relax.
Great. Our next question is related to NSAID usage. So the person asked, I have stage 2 kidney disease from NSAID usage. For many years, I tried many products and services to help reduce my back pain. Over-the-counter naproxen worked the best, and they took it as needed. And then in a routine physical, their primary care provider let them know that they had kidney disease. So they're just looking to what other options are there for anti-inflammatory needs?
Yeah. So NSAIDs are a really good medication for inflammatory type pain. So, but it does cause kidney disease over time if it's taken really regularly. Now, when I see my patients, we talk about the risks and benefits, and it all depends on the individual. In can they still take NSAIDs in a very limited amount? Should they avoid all of them? Other options that I give my patients who I don't want them to take NSAIDs like ibuprofen or Aleve. I typically recommend Voltaren gel or topical diclofenac ointment, which is an over-the-counter NSAID gel. Now, it doesn't typically cause decreasing kidney function or any heart problems, but definitely bring it up with your doctor if that's something you want to start. Otherwise, other topical medicines like BioFreeze or lidocaine are good options. Now, if those don't help, again, it's a good idea to reach out to your doctor and ask them what other options you could have. or asking to be referred to services like pain management, just to help get that pain under control, because back pain can be very debilitating and it's never fun to live in pain.
Yes, great. The next question is, what are the most important foods to avoid with chronic kidney disease?
Yeah. So chronic kidney disease has quite a few stages. So there's stage 1 through 5, and then end stage kidney disease. It's not a disease that has to progress. So if your doctor diagnoses you with chronic kidney disease stage 3, depending on the cause, it's something that you could stay stable at the rest of your life. Now, as far as foods to avoid, there's really no foods that we recommend avoiding with chronic kidney disease until you get to really late stages. And that's late stage 4, stage 5, or patients who are on dialysis. And then we recommend limiting foods with phosphorus and potassium, just because your kidneys aren't able to get rid of extra very well. Now, overall, there's really nothing you have to avoid with having kidney disease. We do generally, though, recommend a low salt diet. Again, the kidneys play a big role in the blood pressure and can be affected by high blood pressure. And following a low salt diet overall is a better option when you have kidney disease.
Sounds good. All right, the next question. I have one kidney and often become faint, especially in the morning. I have increased the amount of water intake during the last few years, which seems to help. What is the connection between fainting and water intake?
That's a good question. So having one kidney is okay. A lot of people only have one kidney. Sometimes they don't know about until they get a picture of their abdomen for something else. Now, with fainting, sometimes that has to do with a low blood pressure. So making sure that your doctor is checking your blood pressure sitting and standing, and then making sure you're staying well hydrated. Sometimes when people have a low blood pressure or low blood pressure when they stand up, that's actually when you need to have a little bit more salt in your diet. So when I have patients who have low blood pressures or they're standing up and having a very low blood pressure, I actually recommend they increase their salt intake somewhat. So it has to do with making sure you're staying hydrated, but also making sure that you are getting enough salt in your diet if your blood pressure is dropping. So, and this is definitely something to talk to your doctor about and make sure that you're getting a sitting and standing blood pressure just to see if it's going down when you stand up, because that's a very common cause for feeling lightheaded, dizzy, or even passing out.
Okay. We did just receive a question in our chat. Do CBD and CBG products have effect on kidney health?
So, with the cannabinoid products, we actually don't have a lot of information on how they affect the kidney because it's not really an FDA approved medication. Um, the information we do have in general, cannabinoids don't cause ill effect to the kidneys, but because it's not an FDA approved product, it's hard to know because with supplements, they don't have to go through the same rigorous testing that um, FDA approved medications need to go through, or medications that are sold through a pharmacy have to go through. So there can be things in it in different quantities than are identified on the bottle, or even things in there that are not identified. So I wish I had a better answer, but we just don't have enough information about cannabinoids in the kidneys.
All right, thank you, Dr. Blonsky. A
Yeah.
couple more questions here. Will 2 cups of coffee affect blood pressure, or do you recommend decaf?
Yeah. So I like my patients to be able to live their lives. Some people are affected more by caffeine than others, but in general, having about 2 servings of coffee a day, and by serving, I mean about a cup or 8 ounces, is okay. Now, if you're noticing your blood pressure is going up a lot with this, then decreasing it. But limiting yourself to about 1 to 2 servings of caffeinated coffee a day should be fine. And I tell my patients that it's okay to have coffee, it's okay to have caffeine, but to limit it to about 1 to 2 servings.
All right, sounds good. And I'm going to read the next question, and I apologize if I mispronounce these medications. Um, I would like to know the long-term side effects of hydrochlorothiazide, losartan, and nebivolol as they relate to overworking the kidneys. I am looking for alternative therapies.
Okay. So the hydrochlorothiazide is a water pill or a diuretic. Losartan is an ARB, and then nebivolol is a beta blocker. Now, none of these really overwork the kidneys. Now, they are all good medicines for blood pressure control. We so with ARBs, they don't hurt the kidneys unless you're dehydrated. So I give my patients sick day instructions. But again, it's important to talk to your doctor about um, your situation specifically. But in general, I tell my patients that if they're vomiting, having diarrhea, and they can't keep up with hydration, I have them skip their water pills and ARBs on those days only. But otherwise, these are very good medications and they can be given long term. The more concerning issue is if your blood pressure is uncontrolled for a long period of time, you can end up with worsened kidney function and chronic kidney disease with kidney scarring. Now, some alternatives could be if you're obese or overweight, losing some weight, increasing physical activity, limiting your salt. And if you're able to bring your blood pressure down with lifestyle modifications, that's when we can start stepping down on blood pressure medicines or even stopping.
All right, thank you, Dr. Blonsky. We did receive a question here. I can go ahead and answer this one too. Does Security Health Plan offer a blood pressure cuff? And the answer to that question is yes. If you are a Security Health Plan member with our Medicare Advantage or Medicare Supplement coverage, you have access to our over-the-counter benefit program. So that does offer a $30 quarterly credit to use toward the purchase of any over-the-counter items, vitamins, supplements, and one of the items that's included in that program is a blood pressure cuff. So if folks would like one at their home to use to monitor their blood pressure, certainly look into that. We can always get you some more information about that program as well. And then we did receive one question here in the chat too, Dr. Blonsky. Does kidney disease give you leg cramps?
So that I wish I had a very simple answer for that. The answer is maybe. So sometimes the anemia that goes along with kidney disease, when you have advanced kidney disease or low iron levels that can go along with it, that can cause some muscle cramping or pain. Now, the other question is what other medications are you on? How are your electrolytes for those vitamins and minerals? So the answer is maybe. I apologize. I wish I had a better answer. So kidney disease, though, on its own, without any other problems associated, typically does not cause leg cramping. But if there are any electrolyte problems that go along with it, or medications that you may be on, or having low blood counts and low iron as a result of the kidney disease, then it might cause it.
All right, sounds good. Thank you, Dr. Blonsky. I am not seeing any other questions here in the chat. So folks, if you have any other questions, feel free to send those in and we'll get them over to Dr. Blonsky for an answer for you. But I would like to thank everyone for joining today. Dr. Blonsky, thank you so much for your time. Have a great day, everyone. We'll see you next time.
Thank you.